This is Esther James again from NTR TV, and as we continue from bringing to you special information from the health sector all the way from Ankara, the capital city of Turkey, and we have been giving you some information from Koru Hospital, which is one of the most recognized private hospitals here in Turkey, Ankara to be specifically. And last time we have introduced to you the people, the specialists in charge of the international patients coming from different parts of the world, including the African continent. We brought to you the Heart Center, and today I'm pleased to introduce to you a specialist from the Urology Center of Koru Hospital. Thank you very much, sir, for having you on this program, attending to NTR TV as well.
Glad to be.
Yeah, thank you. Could you please fully introduce yourself to our viewers, what specialties you are into, what department as well?
Of course. Hi everyone, I am Dr. Giray Ergin. I am a specialist in urology and robotic surgery. I have been working at Koru Hospital for about 8 years. I give treatment in all subdivisions of urology. However, uro-oncology, kidney stones and prostate disease are my special interests. I'm happy to be here with you.
Thank you very much, sir. Koru Hospital Urology Clinic is one of the most important clinics in Ankara. Robotic surgery is applied. Would you tell us, can you give more information about this particular department?
Of course. Our hospital is located in Ankara, which is the capital city of Turkey, you know, and has been providing health service for nearly 20 years. During this time, it has grown and renewed and has become one of the largest healthy institutions in Ankara and one of the leading healthy institutions in Turkey. Of course, during this time, the urology clinic has been one of the leading clinics since the beginning. Today, our urology clinic has a very high efficiency with the latest technology devices and doctor quality. In addition to successfully treating our patients, we also conduct research in the academic field and continue to contribute to the world medical literature. As a urology clinic, we provide outpatient service to an average 1,000 patients annually, and we operate about 2,500 patients. It's huge.
It's a huge number.
Yes, huge number. As our patients from all provinces of Turkey come to us for treatment, we also have many patients from other countries. This is a very large number, you know.
Yeah. Having this kind of massive, would I say, a massive services to a larger number of people, what can you tell us about your physician staff carrying all the services to larger number of patients?
Of course. In our urology clinic, we currently have 5 full-time urologists, including 1 professor, 2 associated professors like me, and 2 specialist doctors. In addition, we have 3 professors working with us part-time. As it's now, the technological infrastructure is almost as important as the surgeons using the device. We have all of the technological surgical devices used in the world today, especially the Da Vinci robotic system in our clinic. We have it, and we use them successfully in the treatment of our patients in and effective. For example, we have all the latest technology device, such as simple bipolar and monopolar transurethral resection device, flexible rhinoscopy device, and nephroscopes for the use of kidney stones, prostate biopsy device, laparoscopic equipment, and thallium laser, and the surgical robotic system. More importantly, we can use this device quite efficiently and successfully.
Wow, that's amazing, and we can see there are so many aspects of things, treatments that the robotic make use of in the system. So what particular diseases that the robotic surgery handles, the one they'll say, okay, the doctors take care of, this one is the robotic surgery that is going to take care of? Which diseases in particularly could you say?
We successfully perform all surgeries and treatments in the field of urology specialty. For example, radical prostatectomy for prostate cancer as an oncologic surgery, TURB and radical cystectomy for bladder cancer, depend on the type of stage of the bladder cancer, and we perform the new bladder from the bowel for the bladder cancer, and radical nephrectomy and partial nephrectomy. We perform the kidney cancer, radical orchiectomy for the testicular tumors, and lymph node dissection for the testicular tumors and retroperitoneal mass. We can perform all of this surgery with open laparoscopic and especially robotic surgery methods. And TURP and thallium laser prostatectomy, robotic simple prostatectomy, which are close methods in benign prostate enlargement, and retrograde intrarenal surgery, percutaneous nephrolithotomy in the treatment of the kidney stones, another open of urinary channel structures, penile prothesis implantation, correction of penile curvature, urinary incontinence surgeries in women and men. In children, hypospadias, undescended testicle and kidney stones, vesicoureteral reflux, pyeloplasty, extrophy vesica surgery. We perform them in children.
There's so many. So many that I have never heard of them before. This means that the hospital here, the services you render, it's not found in other hospitals, and having the records of having a large number of patients yearly coming to this hospital, in this urology center or clinic, will I say, which particular aspect, or will I say the diseases, it's not really much available. Let's talk about Africa. Currently, lots of African people are coming to abroad for treatment, basically because of lack of the current technology. So which part do you think the reason why most of the Africans, you will say, okay, we have this technology in this hospital?
Actually, for all the surgery I just mentioned, we have patients coming from African countries, and these patients come back with good health. However, we have slightly more patients for treatment of urological cancers.
Cancer?
Yes, oncological surgery.
Oh, okay.
And stones kidney surgery.
Oh, I see. Amazing. So Koru Hospital Urology Clinic is a clinic that stands out especially with robotic surgery, as you made mention earlier, and the treatment of cancer diseases, which this hospital has a very good record in terms of treating cancer. And in this context, what do we need to understand when you say robotic surgery in the urology center?
Firstly, when robotic surgery is mentioned, the first thing that comes to mind is that a robot performed the surgery. However, in fact, we urological surgeons perform the surgery, not a robot surgery. Depend on the type of surgery, robotic arms are inserted through to 4 or 5 small 8 millimeters holes drilled into the patient's abdomen. Then the surgeon sit on the robotic console and perform the surgery using robotic arms inserted through the small holes without making a large incision in the abdomen.
That's a huge trust for the technology.
Yes.
I could just imagine. So what are the uses of robotic surgery? You just explained it, but could you give us a bit more details on the uses of this robotic? Like, how do you trust it?
We can successfully perform all urological surgeries that we perform open or laparoscopically. We do the robotic surgery. We perform the robotic surgery, all the surgeries.
Yeah, so what are the advantages of this robotic surgeries?
Robotic surgery is actually a form of surgery that changed the rule of the game today. Of course, since it's not an automatical system, the main thing is still the education and experiences of the surgeon on this subject. If we list the advantages separately from patients and surgeon, first of all, its advantage to patients include much less pain, much less scaring, a much quicker return to daily life, less hospitalization time, less blood loss during and after surgery, and better and clear vision in some oncological surgeries, and good oncologic results. For the surgeons, it has advantages such as providing 3D images and eliminating hand tremor and minimize fatigue due to the surgeon sitting at the console.
You made mention hand trauma.
Hand tremor.
In a situation whereby since the human, sometimes we have some shock or something like that. So
yes.
This machine is kind of more advantageous.
Of course.
Compared to saying the doctor is doing it by himself.
Yes,
that's amazing technology. This technology, it came after the pandemic, or it has been in existence before the pandemic?
Before the pandemic.
Before the pandemic, but it's just now people get to know more about it.
Yes,
I see.
we have 1,500 patients.
Coming for that.
Yes, in robotic surgery, we perform robotic surgeries.
That's amazing, that's amazing. The robotic are really taking over our jobs, huh? Yeah, we're talking about the robotic surgery, the advanced technology thulium, which I believe I said it well. Thulium laser is also used intensively in the urology center. Thulium is used in the treatment of which diseases?
You know, the thulium laser is the new technology devices. We have it. We can say that thulium laser is the latest laser technology produced for urinary system disease today. It was originally used for the enucleation of the prostate in the treatment of benign prostate enlargement. We empty the prostate gland completely with the thulium laser, and there is no risk of recurrence. Of course, this is not only this advantage. Thanks to this technology, and I mean thulium laser, we perform this procedure without bleeding. Also, after normal prostate surgeries, the urethral catheter remains for 3 or 4 days. We remove the patient's catheter 24 hours after the operation with the thulium laser. And therefore, the duration of hospitalization time and return to normal life of the patients are considerably shortened We use the thulium laser in the benign prostate surgery as well as in other surgical procedures. For example, in the treatment of large and hard kidney and bladder stones, in the transurethral removal of the bladder tumors, in the treatment of structures in the urethral and bladder outlet. We use thulium laser efficiently in the treatment of all of this disease.
It's amazing. So are there other advantages of this laser, thulium laser? More advantages that you mentioned before? Is there other advantages in terms of safety? It's faster or?
Safety, faster, and zero bleeding for patients. Yes.
Thank you very much, Mr. Dr.
Giray.
Giray. It's a pleasure to have you on this one, and we hope that more of our international patients, especially from Africa, will be able to take advantage of this enhanced technology that you have in this hospital. Coming to the last question, what will be your final advice to our viewers out there, the need for them to come to this hospital and get their treatment?
I'm glad to be with you in here. Thank you so much. We are waiting for our patients who follow us and need treatment in urological illness come to in our clinics.
Thank you very much. Thank you. Hope they will come and they will get the best of treatments.
Thank you.
Thank you very much. Hello dear, thank you for staying with us till this time. If you need more information about Koru Hospital, especially from this department, you've heard from him. If you have missed the beginning of this program, you can also follow on YouTube channel to contact or check the full details of this program to be able to get the best of information that you need. And I am Esther James, bringing to you special information from Koru Hospital, from the urology clinic. And keep watching because we're bringing to you more departments. Take care and have a wonderful day.